name is Catherine O'Brien, and I am with the Metastatic Breast Cancer Network. I have been living with metastatic breast cancer for about 6 years. I was diagnosed when I was 43 years old. I was a de novo presentation. At 43, I'm older than what we would consider a young woman. But my question is, the median age for breast cancer in US women is 61 years old. It wasn't my experience, but I've had many friends, young friends, who went to their doctor, their general doctor, and were told, you're too young for breast cancer. My question or challenge is, many young women with metastatic breast cancer would have had no chance of any sort of screening or detection because they were simply too young. They were not at the recommended age for a mammogram. If they did not have a family history, they would not have been tested. They would have had no contact with an oncologist. So the burden of that discovery lies with the doctor that they would see on a regular basis. And my feeling, after having many friends share with me, is that doctors simply dismiss these women, their complaints. You know, if they were mothers, it was a nursing problem. If they were having some sort of pain, it must be a back problem. So my question is, how can we get the message out there that although it is not necessarily common, it is a real and valid thing that young women do get breast cancer?
The CDC now has set up a federal advisory committee on breast cancer in young women, and one of the main initiatives of that federal advisory committee is to develop and then disseminate risk messaging specifically targeted for young women. So my hope is that with that kind of government funding and that kind of government backing at the federal level, we will see more risk messaging out there for young women. I think, you know, targeting providers and healthcare professionals is another really important way to do this, to make sure they don't poo-poo young women who come in with symptoms or, you know, half diagnosed. They're a harder group to reach, but the CDC's Federal Advisory Committee is working on that as well. So there is some promise that we can get messaging out there. I completely agree with you. Too many women go too long undiagnosed or told by their healthcare professionals that this is not something to worry about.
I was going to say, we at YSC also have educational programs for healthcare providers to let them know that this can happen in young women, as well as the special issues that they confront as a young woman with breast cancer, and especially metastatic breast cancer. And we'll be rolling that out into a larger version. And I think that's helpful. You need to go to the providers, I think, as well.
So there are two components of this. There's the provider education, and you know, with healthcare reform, there is actually a mandate to do a risk assessment for breast cancer. So not everybody gets a mammogram if they're 40 and they don't have risk factors, and MRIs are done if there are indications for it. So there is some education that's working its way up. But if I look at the young women that I see who have large cancers, it's the patient who's been the delay. And I think there you really do have an opportunity to educate women that breast cancer does occur in young women. We know that there's a huge increase in the incidence of breast cancer in young women, and yet they choose to ignore it, do not go see a doctor, so you can't blame the healthcare system for that. There really needs to be an education of young women that yes, they can get breast cancer, and ignoring it is only going to cause the problem to be a bigger problem.
Yeah, at Living Beyond Breast Cancer, we actually, one of our young advocates who lives in a rural area was complaining of just the situation that Catherine described. She went to her doctor, and it was 6 months lost because he did not, this can't be breast cancer. So I think we've heard there are many different ways we need to attack this issue, and it's education to healthcare providers. The CDC has, some of us benefit from the CDC grant on this panel. So there's a 5-year investment in serving young women and education components, and there's media components to it as well. And working with our corporate partners, as Rochelle said, in educating the general public about breast cancer, and that's the only way we will be able to kind of confront that problem.